Welcome to the third episode. In the last episode, we introduced you to all the villains and we highlighted the lower body villains. We talked before that I gave this uh, archetypes to anchor your learning, to be mad at someone that your pregnancy sucks right now. So we went over those in the last episode. We went over Linda low back pain, Sally sciatica, and Peggy pubis. These are the most common uh, problems that I see that steal your joy during pregnancy, that you're unable to walk, put your pants on, sleep. So, in this episode, we're going to talk about truly with my book called What You Don't Expect When You're Expecting. These are not things that you would think causally are related to pregnancy. Of like when you think of pregnancy pain, you're not going to think of what I'm talking about next, but it's so freaking common and it's unexpected, so it's scary. So let me start out by introducing you to the first one. In the last episode, we told you who they're named for. So let's talk about Helen Headache. Again, Helen is my aunt. All my villains are named after family members. All of these are lovely people, as opposed to the villains that I'm making them out to be. But I just wanted to pay homage to my loved ones. But Helen Headache, the villain, is such a debilitating pain in the ass. What she feels like is a myriad of different things. In my book, there's like 6 different types of headaches that you can have. Some can be really helped with sports medicine, chiropractic, physical therapy, massage. Some hormonal headaches can't. So it really is important to understand what kind of headache you're having. It can be dull. It can be an ice pick headache in your eyebrow. It could be the tension that's in your temples from stress. It could be at the back of your skull. So these are the ways why she happens. I'll go into in a second because I'm going to talk about Rebecca rib pain. So Rebecca rib pain, many people don't know. I'm going to knock my hair out. Many people don't know that your ribs actually start, for those of you who can see the video, your ribs actually start where the pointiest bone is C7, right? That's the bottom of your neck. It's the one that sticks out. The next one down is T1. So that's the pointiest one underneath that. From that point, right, goes center bone of your spine, comes around, and it goes under your clavicles, right? So a lot of people, I don't have ribs up there. Yeah, you do. Yes, you do. And it's very invested with muscles. If you're looking at me on the video, if you're able to see video, you can see that like most people, I'm a little bit upper trap dominant. So there's a muscle called your traps right here. You can see mine because a lot of people are forward working. I'm always at this desk. I'm always on my phone. For those of you taking care of your kids, you're always forward doing this. Nobody sits back and does this. So you can see my upper traps. So it's very tight right here. There's a muscle called your levators that make you do this, that are in this area. There is scalenes right here in the front of your neck above your clavicle. So if you make a really weird face that you grimace or clench your teeth, you can see those muscles pop up. So you can see all of this is sort of very invested as it goes under the clavicle. So it not only affects back here, but it affects underneath your clavicles in the front. Additionally, there's a nerve that when you pinch a nerve, either through your muscles are too tight, the bone is out of position, or it's fixated, it's stuck, which is what we do as chiropractors. If the bone is stuck, it has 2 wings on it on the side. That's what the rib sort of makes a peanut butter and jelly sandwich on it. Again, check the video on YouTube if you're not seeing this as a podcast. It's also my courses. This thing meets like this, like a sandwich, right? And when that bone has an imbalance because one side's tighter than the other, it pops the rib head up. It's not popped out of your skin. It's not popped off. It literally just occupies space that it's not supposed to be in. And it feels like you have a spike. It feels like you have an ice pick right here. A lot of those fibromyalgia commercials where they're holding them like this. It's not your neck. It's not your back. It's your first rib, right? Is right in this area. Each part of your spine has a keyhole in the side that the nerve comes out. Each nerve services areas like a zip code, just like a mailman has a certain territory. There's a territory that the nerve that comes out of that nerve, that's where my extruded disc is in my neck that I talked about in a few episodes ago, is I have an extruded disc, which means there's the disc is squirted out and it literally shut my whole arm down. Residually, because I have what I'm talking about with Rebecca rib pain, my disc is right there at that level, right above it. I have permanent coldness in these two fingers because that's the zip code of T1. I have it between C7 and T1. It's called C8 disc, is extruded, and that shuts down or irritates. Sometimes when your nerve is irritated, it can cause more pain where it like ramps it up. So if I turn that light switch on, it's like zzz, and you'll get that toothache, lightning. That's what I had at first. I had that for 6 months, 3 different episodes, and you can't get out of it. It's the worst pain that I would never wish upon an enemy. It's deep, unrelenting pain. That's typically a disc pain. Most of my patients don't go to that level. It's just a sort of annoying pain. Sometimes it could be a tingle. The tingle is almost like if you compress something and you don't have feeling, right? It gets tingly, it gets numb. That's where you get the tingles. And I've had that in here. Mine, because I have such a big extruded disc, I have permanent compression, mild compression. So my hand is like cold and it's tingly. And this happened in 2018. So it's a zip code. So getting back to the ribs, if you have a rib problem, it can be all the way up here. It can be all the way down here because you have all this whole rib cage that supports and protects your heart, your lungs. It's very, very important. Those rib bones are made up of a similar material like we talked about with pegi pubis. It's a very bloody bone, right? Your ribs tend to bruise. Your pubis, if you push into and hit the bone, it's going to bruise, just like a shin splint, right? So a shin splint is almost the same as pubic pain, the same as a rib. So when we work on the rib bones, if you eat ribs, if you eat meat, it's a very bloody bone in it, which is great for healing. It has a great blood supply, but it also bruises. So if you have a rib injury, typically because you're carrying a kid, if you see the video, you're carrying a kid, you're carrying groceries, you're carrying a bag full of books. If you're doing this, your shoulder blade comes out in the back, the wing bone comes out, and then where your spine is and where the ribs are, it separates, right? It's not protected by its little fortress of shoulder blades. So shoulder blades yeet out, and then what you're stuck with is in between. The rib head is unprotected. It's an imbalance in the muscle, and it pops up, right? Pops that thing up. And as I said, when that pops up, just malposition just a little bit to irritate everything. Additionally, we talked about the keyhole in the side, right? When the keyhole goes like this, it pinches the nerve, and you can get pain that comes around here, which when you're pregnant is terrifying. It's terrifying to you. It's terrifying to your doctor sometimes, and they may send you, depending on which side it's on, right? This is my right side. This is my left side. It could be your gallbladder. That pain is also, that's one of the differential diagnoses or one of the options of what you're having this problem they need to rule out. Sometimes when you're first pregnant, a lot of people will get left shoulder pain, and that's an indication that you need to worry about. As a provider, I need to worry, hey, they might have an ectopic pregnancy. So if that baby hasn't been visualized, if you haven't had an ultrasound and you're newly pregnant, you come into my office, you're like, I have this sharp pain in my shoulder blade, shoulder. That's the first step. That's the first thought in my mind, is not, hey, you have a rib out, like what I'm talking about. Hey, this person may have an ectopic pregnancy. I need to order an ultrasound, or I need to call their OB, or I need to call their midwife and make sure we screen and make sure the baby is in the proper position, because the body is so cool that when you started as an embryo, right, as a cluster of cells, as it pulls back, things that were attached are like pen pals. It's cool, right? So that's there's myotogenous pain, so coming from a muscle where I can push a muscle and it'll send pain somewhere else. You can have stuff that starts in your organs and it'll manifest as pain somewhere else. This is not a chiropractic thing, it's a medical thing. It's really super cool. So these are things that you need to be aware of with Rebecca. And that's what I said about her being Regina George, is Helen headache could be dangerous, right? It could be other things. And as a paramedic, if you ever have the worst headache of your life, or if you hear yourself saying, this is the worst headache of my life, you need to get checked, like immediately. And I've had some debilitating headaches, so you should always be checked. But the rib stuff is so intermingled with where that baby is, and it is so sharp. And the reason it's so sharp is because you have vital organs and your body is acutely aware. It pays attention to this area. So the nerves in certain areas are hyper. Like here is very sensitive. Whereas in the back, you can get a massage. If I massaged your ribs, like some people massage your back, you'd be in horrible pain because this is more sensitive, if that makes any sense. So, and it also, as I said, the baby is here. So Rebecca rib pain is any pain that starts from T1, which is set as the top of your shoulders, all the way down to your back. And what that does is it causes immense pain, and it can radiate the pain, like I talked about in the neck, that it can send to your hands. This shoots around your ribs. If you ever eat ribs, if you look, there's a black line, which is disgusting to talk about. There's a black line. That's the nerve that you're eating. But that's how it works, is it shoots around, and it can control, right? The nerve from your spine controls the muscles in the top of your abs. So sometimes it'll contract that where the person will get a pain here. Not in their bone. They'll say, hey, this feels funny, but they have sharp pain right here. You know, the other thing that could be is you had really nice abs before you got pregnant, and your body's like stretching out on this thing. Like right now, the shirt is probably like how my belly was before I got pregnant, if you were seeing this with a video. Some people have like a real tight abs. I never have had tight abs, but that can push against, that can cause sharp pain. So there's like a million things as a doctor I need to be really careful with if you come into my office with that. That's Rebecca rib pain. The final thing that we've talked about is Wendy wrist pain. We talked about Wendy wrist pain, and that is when you have pain in your wrist. Typically, that's in this area. That's called the snuff box. Like, make your thumb do that. There's a hole. They said people used to put tobacco in there. I couldn't fit much tobacco in there, but in this area, that's where they get baby wrist or Dequer veins. And it gets to the point, sometimes the whole carpal area, your wrist area, gets swollen, and that puts pressure on the nerves that your hands go to sleep. So people who have other kids, they're like, oh my God, I'm going to drop my kid when I walk down the stairs. I'm going to drop my keys, drop my coffee. It's very common, and it's treatable, right? And especially predominant after you have the baby. So that's what we're going to talk about in future episodes, but that's Wendy wrist pain. So I hope this answered your questions of the top 6 things that I see in pregnancy. And this is what I built my patient courses, my provider courses. It's basically, how did this start? What is this? Why does this happen? What do you need to start doing? What do you need to stop doing? What are massages, exercises, stretches, sports medicine before pregnancy, during pregnancy, after pregnancy? There's different phases of what you can do, and you can do a lot. And I want to give you those tools of what is safe and what is trusted, what is vetted, that you are able to take stuff off a shelf and be able to apply it so that you don't feel helpless. The worst thing I could say in my profession and other professions is dependency. And I think knowledge is power. The more you know. The more you know, the more you're able to understand. And when you understand, you can calm down about like, oh, this is not normal. This is common. This is how I fix it. This is what I might be doing to make it worse. Let me try this thing I saw in her courses. Let me try this thing I saw in her books. That's what I've dedicated my life, is empowering you, just like a friend, just like a big sister saying, sis, I got you. This is how you do it. Hope I've given you some awareness of these most common problems in the upper body, that you're able to have an awareness that this is common and treatable. Please check out my resources on drbrandie.com so that you're able to get the resources you need to have the best pregnancy that you've dreamed of.